Okay, this video is called How to Treat a Bad Disease. It ain't just the food. So what this comes down to is, let's say you've got a bad disease. It's a 10 out of 10 bad disease. Let's say your immune system is only a 4. What that means is it's your immune system that heals you from a disease. Your immune system has to fight the disease. So if you have a 10 power strength disease and you only have a 4 power immune system, you're just going to get sicker and sicker, deteriorate, suffer, and die. Okay, that's what's going to happen. Most patients have bad outcomes. All this stuff, patients live in fantasy land thinking they're going to get healed or cured. Usually they just suffer and they deteriorate and they die. All right, so we're going to talk about how do you have a chance, give yourself a chance to win the game. Typical diseases patients have, the majority of them are fat, hypertensive, diabetic, coronary artery disease, and they often will have a bunch of other comorbidities like peripheral vascular disease, cerebral vascular disease, autoimmune disease, abdominal pressure syndrome, gastroesophageal reflux, psychiatric-like conditions, anxiety, depression, insomnia, can't sleep, arthritis, cancer, restless legs, tremor, multiple sclerosis, etc., etc., etc. Okay, so you go to conventional doctors. What does conventional system have to offer? They're going to do some blood tests. Sometimes that's useful. Endoscopy, they'll stick a tube down your throat, down into your lungs, into your mouth, up your butt. They'll biopsy something if they see it. They'll do an X-ray, ultrasound, CT scan, MRI, nuke med, catheter angiography. And then in the end, they're going to treat you with drugs or surgery. That's what they do. In special circumstances, radiation therapy with cancer. But that's it. That's all they got. Drugs and surgery. Okay? And what's the cure rate with drugs and surgery for, hypertension, diabetes, coronary artery disease? 0. Okay? 0. It's always 0. It can't cure those diseases. Antibiotics can cure infections sometimes. That's good. All right, so now we're going to talk about what else you can do. And what I'm talking about is it's your immune system that heals you from a disease. Actually, I'll just keep myself over here because we're not really going to be using this too much. All right, so you want to, strengthen your immune system. All right, so how do you strengthen your immune system? Well, first of all, you want to eat low-fat diet because high-fat meals, they markedly degrade the immune system. If you want to see the scientific presentation on that, check out Lydia Lynch over at Global Immunotalks, okay? So that's rule number 1. It has to be a low-fat diet. Number 2, you want to eat all plant food diet because all the good stuff's in plants, all the bad stuff. You've heard me talk about nutrition a lot in all my other lectures, so I'm not going to talk about it too much. But just know that low-fat, low-sodium diet strengthens your immune system, okay? So you want that. If you're fighting cancer, you also definitely want to be 100% vegan. Because all animal protein, it tends to accelerate cell growth and replication, and it's acidic, all these things that worsen the prognosis with cancer. And ideally, the diet should be whole foods, single ingredient only, 100% organic, 100% vegan, no oil, not one drop. They're all bad, including omega-3 oils and fish oil. No high-fat foods, no flax, no soy, none of that stuff, okay? No avocados, no caffeine, not at all. It can interfere with your sleep. Sleep is like psychological stress. If you're sleep deprived, that's like psychological stress, elevated cortisol and catecholamines. The diet's the most powerful thing in all health. Avoid any processed foods, tobacco, alcohol, MJ, powdered foods. They often contaminate powdered foods with heavy metals. Okay, so that's can bump you up about 3 units. So you go from an immune system of about 4 to about 7. That's the most powerful thing you could do. Filter your water so you get rid of the EDCs, estrogen, endocrine disrupting chemicals, mostly estrogenic chemicals. Okay, there's oral contraceptives in there, there's phthalates, there's BPA, and a whole bunch of other estrogenic chemicals, BPS, other BPA analogs. The fluoride, it's a major neurotoxin, it's a dementogen, it inhibits collagen synthesis, it poisons glycolysis, does a whole bunch of bad things. It inhibits mitochondrial function, inner mitochondrial membrane. Avoid aluminum. So by filter your water with reverse osmosis, you'll get that as well. And you'll get rid of the excess chloride too, which also has negative effects on you. Some is normal. Some chloride's normal. Some sodium's normal, but excess amounts are bad for you. Okay, you want to minimize all these personal care products. You want to be a minimalist. You want to live like Adam and Eve, but keep your indoor heating and plumbing. You want to stop using deodorant. That's stupid. You walk in the room, you say, hey, how you doing? You don't sniff each other's armpits. If you cook without oil, you don't need dishwasher detergent. Unless you work, in some really filthy place, you don't need laundry detergent. You don't need those anti-wrinkle stuff. All that stuff's full of estrogenic preservatives because they prevent mold growth, okay? So they get put in everything. Avoid things that smell bad. Things that smell bad tend to be SERCA inhibitors. So You don't need to paint your house. You want to stay away from volatile organic chemicals. You don't need to go to the dry cleaner where they expose you to things like TCE, trichloroethylene. Don't use your air conditioner so much. There might be fluoride in it. The fluoride contributing to how it's made. Avoid all the mitochondrial inhibitors. I've given you a list of 100 of them. If you're on any pills, see if you can get off them. Make sure you're not on, drugs inducing atrial fibrillation, that sort of thing. Get your sleep at night. You don't want to work the night shift. People who work the night shift, they got like 50% more serious cancer, breast cancer, etc. Your body can handle something at 20 years old, but it can't handle the same thing at 50. You become more fragile as you get older. That's like the big difference of getting older. Avoid excessive blue light at night and the screens and stuff because they'll decrease your melatonin production. Melatonin helps you sleep, but it's also an antioxidant and health promoter. Get your sunshine in the day because you get vitamin D. Sunshine also activates your mitochondria in a positive way. I think it liquefies the water phase around the ATP synthase. There's good reason to say that. I'll show papers in a future talk. Watch it, and so avoid the screens at night. Don't work night shifts. Get your sleep. Avoid fluorescent lights to the extent you can. They give off a little bit of mercury. Better to have incandescent and halogen lights in your house, and don't use more light than you need. Dim the lights towards the end of the night. Avoid them. I have little low power bulbs in areas I have to go at night, like 15 watt or something, because I want to be exposed to less light at night. LEDs are bad, all the blue light typically. There's some benefits to red light. I haven't figured it all out yet, but there's some benefits to it. Avoid excitotoxins, any type of stimulants. Caffeine is the classic one, aspartame, glyphosate. High-fat diets lead to increased beta amyloid protein entering the blood, crossing the blood-brain barrier, going into the brain, and being an NMDA excitotoxin. Glyphosate's coincident with NMDA, calcium channel on your postsynaptic neuron, so it's an excitotoxin. You want to avoid all that stuff, any type of stimulant, nicotine, etc. Minimize your exposure to EMF to the extent you can. You might not at your job, but minimize it at night at your home. Use your speakerphone on your cell phone. Don't hold it to your head to the extent you can. Avoid Wi-Fi if you can. Switch your house to hardwired. What else? I mentioned also dental. Don't ever go for fluoride cleanings. That's a bad thing. If you got amalgams, consider taking them out. Don't do it without thinking, but consider taking them out. I would take them out and not put anything back. I do have some myself, which I have not taken out yet, but I'm strongly considering that. You got to go to IAOMT, International Academy of Medical and Oral Toxicology, because they're the ones that know how to do it correctly. Regular dentists, they're like McDonald's. They don't really know what they're doing. If you also got, amalgams in your mouth, you probably also got copper, maybe even nickel. They're all bad. Watch out for aluminum. They put aluminum oxide in the composites. That's why I would just leave the tooth socket empty. Root canal infections, you might need to get those out. Again, a lot of people tolerate them well while they're young, but some as they get older, it ends up causing a problem. Some people get a quick temporal relationship where they put it in, and then pretty soon after they get sick. That's an even stronger indicator to remove it. Exercise, just because you'll sleep better at night, you'll maintain your mitochondria better. Your body's sort of a use it or lose it system with limited resources. So if you tell it you need those mitochondria for exercise, it'll maintain them better. Sweat, because your sweat glands are like little kidneys. They'll excrete the mercury, the arsenic, and other toxins. And like I said, you sleep deeper, your immune system will work better, everything functions better. Have some type of worldview where you maintain hope, at least in some ways. We're all half screwed in a lot of ways, but maintain hope for a few things. Have a strong sense of purpose. I will be the best teacher, the best coach, the best scholar, the best doctor, whatever you do, or whatever is important to you as your hobby. Try to pursue it to excellence, because you become happy when you feel like you're improving and you're doing something good. Your life's meaningful. Have some type of social life. Maintain good relationship with at least some friends or family. That brings happiness and purpose to life. Maybe being a good parent might be your big goal in life. Whatever it is, to do something good. Christianity is great at giving you a sense of purpose. It basically says there's a struggle throughout the earth between good and evil, and so be on the side of good. Lord, make me an instrument of your good, that I may serve you and do something useful. That really energizes a person, makes them more resilient. Forget about modernism. Almost all modernism stuff is evil, so you want to avoid it as best you can. Well, anyways, you do all these things. You can keep on bumping your immune system up in little tiny increments, 0.3, 0.5 of a point, and you can get it up to a 10, maybe get it up to 11, and then you could fight that disease, okay? There isn't a guarantee, but there's tons of people who've tremendously been able to resolve terrible autoimmune disease, atherosclerotic diseases, diabetes, hypertension, even kidney failure, and slow it down or cure it depending on the disease. You've all seen tons of reports on these in all the vegan channels. And so what I'm saying is this is how you do it. You incrementally build yourself up by doing everything right on all these little steps. Why wouldn't you want to do it? And now like the dental, that's a huge thing. Getting the sleep and avoiding all these bad lights, that's a huge thing. Avoiding all these mitochondria inhibitors, excitotoxins, circa inhibitors, that's huge. EMF, now don't EMF yourself, stay warm. Some people even like a mild sauna. Be careful about overdoing a sauna. But anyways, these are a lot of things you can do to improve your immune function and to give yourself a chance to get better. I've seen lots of people make dramatic turnarounds when they do all this, but I would not half-ass it. If you're real sick, your life's on the line, and you'll hit irreversible roadblocks if you don't get things turned around. The faster, the better. So anyways, I hope you found that helpful.